Most people are familiar with the term menopause. However, it's still quite a mystery to many of us, women included. In fact, it is thought that more than 80% of women under the age of 40 either have no knowledge or only some knowledge of what menopause really is. And that's quite alarming, isn't it? Today, we're going to give you some information, some 411 on menopause and all the syndromes related to it. We're going to debunk some myths and answer some of your questions here on Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome to Ask the Doc, the show where we encourage you, our viewers, to send in your healthcare questions and we answer them. My name is Dr. Kamaljit Kaur, and I am a primary care physician here in beautiful South Florida. Today's first question comes to us from Lucas, and Lucas reached out to us through our website, allhealthtv.com. Let's see what Lucas has to say. So he is asking, hey, Dr. Kaur, my wife, the absolute love of my life, has become a little moody lately and has been having trouble sleeping. Now, I'm no genius, but at the age of 48, is it possible she's going through menopause? And if so, what causes it? And what can I do to help her deal with it? Hi, Lucas. Let me just first say that you are such a sweetheart for being so supportive and such an understanding and loving husband. So kudos to you for that. And I'm so happy for your wife that she has a partner like you. Now, it's hard to say without speaking to her personally and really getting into the nitty gritty of what she's feeling. But yes, menopause can certainly begin around this age. To begin with, let's define menopause because as I said earlier, a lot of people don't even really know what menopause is. There's a couple different ways to define it, but technically, menopause is when a woman has stopped having her menstrual periods for at least 12 months, and that's not caused by any other health condition. Now, during this time, there's also a lot of hormonal changes. So, if your wife gets blood work done, that might be something that's apparent as well. Changes in reproductive hormone levels and other factors as well. Now, the average age, because everybody's different, but the average age that a woman goes through menopause, studies have shown, is around 51. It is quite variable though, and we see that 5% of women actually go through menopause earlier, and that's between ages 40 and 45. And some women, on the other hand, actually about 5% undergo menopause later. So after the age of 55, even. Now, any menopause before the age of 40 is considered abnormal and generally due to a non natural health condition. So, for those women, I do encourage you to talk with your primary care physician or your gynecologist to really get into the details of what might be going on. Now, that being said, it's not like it all just starts one fine day and a switch goes off and now you're in menopause. I mean, that might be easier if it did, but menopause is actually a whole transitional period. And that initial period where this journey starts can be called or is commonly known as perimenopause. And that's when your hormone levels are changing or beginning to change and fluctuate. And as a result of that, a woman is going through a whole bunch of different symptoms. Now, it's possible that a woman goes through 10 different symptoms. A woman might go through one symptom, and some women don't have any symptoms. It really is very, very variable. But one of the main points that I like to let my patients know is that no matter when your body goes through menopause, it's actually possible that you started the perimenopausal or transition period up to 4 years before that. So, up to 4 years before your periods start, you might start to notice changes in your hormones, your periods, and that can lead to a whole variety of symptoms that we'll get to in a little bit. But that whole period is not necessarily just right before menopause. So it can always start years before. And there's a variety of symptoms that can occur during this period. And these symptoms can vary as to how bad they're going to be for one woman versus another. And that even depends on a lot of factors. It's quite complex because, women, we Like we didn't need something else more complex. So some of these symptoms are, yes, the commonly known hot flashes, there's mood swings, sleep disturbances. A woman can also experience vaginal dryness due to the reduction in estrogen levels in her body. There can also be mental health conditions as well. So there's different symptoms that sometimes we want to be aware of. And it is possible, Lucas, that your wife is going through perimenopause and transitioning into menopause. My best advice to you is what you're already doing for her. You want to be there, support her, and encourage her to talk to her medical providers, talk to her primary care physician, and talk to her gynecologist to really get a picture, a whole picture of what's going on so she can be evaluated, diagnosed, and then treated if necessary to restore her and your quality of life. I hope you guys do well. Let's get to the next question. This one comes to us from Nomi, and Nomi asks, Hi, Dr. Kaur. I'm a 38-year-old woman who hasn't been feeling well lately. I'm getting headaches and a general sense of malaise. Does this sound like menopause to you? And if not, what are some of the symptoms? Hi, Nomi. It doesn't sound like menopause, but I still suggest that you go see your primary care physician to really sit down and talk about what might be going on and why you're not feeling well. Now, as far as symptoms go, I know I mentioned a couple of them in answering Lucas's question earlier, but let's get a little bit more into detail about these. There's a variety of them. And like I keep saying, I don't want women to be afraid. This is a natural transition in life, and these symptoms may or may not occur. They may occur drastically, and they may just be mild for some women. So the first symptom, like I mentioned, is commonly known. It's probably the most popular one, and it is hot flashes. Now, for those of you who have experienced hot flashes, I'm sure you know how intrusive and bothersome they can be. And although there's a whole mechanism in your body that's happening that's contributing to these hot flashes, there is treatment for it. So please do talk to your doctor and see what's best for you. The second symptom I want to outline is night sweats. Similar to hot flashes, mechanisms are similar, but point is it's very, very annoying. It's very intrusive and it can disturb your sleep, of course. Now, when you have night sweats, you could see that your pillow is completely soaked or that you're just sweating a little bit when you wake up. No matter how good or bad or mild or severe the symptom is, though, you want to make note of it and talk to your doctor about it. The third one that a lot of women experience is vaginal dryness. And this happens due to the natural decline in estrogen and due to the stopping of your body producing estrogen, which actually promotes lubrication in the vaginal area. So when you don't have the estrogen, you're going to experience dryness in that area. And again, there are treatments for this as well. So please do talk to your doctor about it. The fourth one, and one that is quite common and probably as popular as hot flashes, are mood swings. Because of the hormonal changes that a woman is experiencing, that can wreak havoc on your mental health as well. And that has to do with a lot of things going on in the body, but those serotonin pathways, those dopamine pathways. So that can all certainly be affected. And you can experience symptoms of anxiety, depression, and even sleep issues because of even those. Now, going on to our next one, in that note, sleep disturbances, number 5. It is very common that a woman who's going through perimenopause and in that postmenopausal stage to experience sleep disturbances. Maybe you are having a difficult time falling asleep, or maybe it's easy to fall asleep, but you just can't seem to stay asleep, or both, which that's even more annoying. So yes, those are some symptoms that we see in menopause and perimenopausal women as well. Number 6, probably the one that my patients dread the most and find to be the most intrusive to their quality of life is weight gain. And this happens for a variety of reasons, just like everything else, but it is commonly seen in perimenopause and menopause. And number 7, last but certainly not least, is a decreased libido, which can be quite altering and intrusive to your quality of life. So again, that's something that even though we understand why it happens and sometimes even expect it to happen, it's not something that we want our patients to suffer through. So any of these symptoms, if you experience them, please do talk to your doctor because there are treatments out there now and we would love to help you with those. Now, these are some of the most common ones. There are other symptoms that a woman can experience. Either way, if you feel something, say something, get it checked out. All right, let's go to our next question. And this one comes to us from YouTube. And this one is from Shoshana. Hi, Shoshana. Hello, Dr. Kaur. I was part of a women's health forum on Zoom call last week. I got on the call late and heard the term perimenopause used. I'd love to know what it is and how it's different from menopause. Thank you for sending us your question, Shoshana. It's a very important question, too. But before I answer it, let's take a look at this video from our friends at the Mayo Clinic.
Menopause is defined by no menstrual cycle for a year.
Mayo Clinic's Dr. Stephanie Fabian says women won't know they've entered menopause until they've experienced a full year without menstruation.
Perimenopause is the time leading up to that, and for many women can last a long time. 6 to 10 years is possible.
That's when you may experience irregular periods and a host of other symptoms, including hot flashes, night sweats, sleep issues, and mood changes.
Also, sexual symptoms, low sexual desire, vaginal dryness, pain with sexual activity.
She says there's been a lack of education and resources for women regarding menopause. There are reasons for that.
One is that menopause can happen at different ages for women. So anything after age 45 is considered normal for menopause.
And perimenopause can begin as early as 35.
But in general, women aren't hearing this from their medical providers, which is problematic because while some women may have no symptoms going into menopause, many women actually have a laundry list of symptoms, and sometimes they're very confusing to sort out.
For the Mayo Clinic News Network, I'm Dee Dee Stephen.
That was a great video, and I think that was a great explanation into the brief introduction of perimenopause versus menopause. I think one of the key takeaway points, or a few key takeaway points here, is that women can start to experience symptoms of perimenopause or the hormonal transition years before they actually go into menopause. And that is not something that's openly and commonly and regularly discussed, and it really should be. I must thank social media, because one of the silver linings of social media is that the knowledge of this and the fact that it exists is getting out more and more. So more and more women are becoming educated in it. They're talking to their doctors about it, and they're getting treatment and living a healthy, happy life because of it. So that being said, just like they mentioned in the video, yes, perimenopause can start years before menopause actually happens. So years before a woman's periods actually naturally stop. Average is about 4 years, but yes, as mentioned in the video, this can be as long as a 10-year process. So that's a lot of time to go through something and not know what your body is doing and what you're going through, right? Now, even though the transition into menopause is natural, and it's going to happen to all women at some point, it's not something that should be not discussed or not looked at or not treated. And it's something that there's still research going on as to why these things happen, how exactly they happen, so we can best treat them. But I just want to encourage everybody to please talk to your doctor about it. Now, with perimenopause, you can experience a variety of symptoms, as we've been saying over and over again. Some of these symptoms may be really mild. You might just get a hot flash here and there, or you may get hot flashes every 5 minutes. It's very possible. Personally, I have not gone through menopause, but I do have family members. I do have my mom, my aunts who have gone through it. And some of them have experienced absolutely nothing, and they've been very lucky. And some of them have had very, very significant symptoms. So it could be all over the place. And I want women to know, I understand one of the most frustrating things as a woman and as a physician is telling my patients, or not being able to tell my patients, exact items. We're not able to tell you this is exactly how long your perimenopausal period, excuse me, is going to last. This is exactly when you're going to start menopause. This is exactly what's going to happen. It is so variable, and we don't know exactly what your course is going to be, but we want you to know that it's coming. Expect something. When something starts, come talk to us. Your support is there, and we are there to help you along this journey. So I want to emphasize that point. Now, after you start to begin perimenopausal symptoms, you may also notice changes in your period. So not just hot flashes, sleep disturbances, vaginal dryness, this, that, whatever. You might actually get actual changes in your period. So you want to keep a diary. You want to make sure that you're noting how often these changes are happening, what you're experiencing, and how they're related to each other. You may begin to experience in the early transitional phase, you may begin to experience that your menstrual cycle, so not the period, but the cycle itself, is either longer or shorter, and generally by a week or so. So you may start to get your period a week early or a week later. And that may be consistent for a while, And then you might start to see changes in your actual period. So you see that your actual period now, not only is it coming sooner or coming later, but now it's lighter or it's heavier or it's spotty. So you'll see those changes in certain stages. And again, I always encourage my patients to keep what we call a symptom diary. So you have a good outline and data set for what's been going on and what direction it's going in. It also makes it easier for your physicians to sit down and have a discussion with you and to give you that anticipatory guidance and see what treatments are going to be best for you. It's annoying that it's variable, but we're here. We're going to help you figure it out. Now, after years of experiencing this transition in your menstrual cycle and your menstrual periods, you will then go into menopause. Now, we really don't diagnose menopause until you've been in it for about a year, unlike most other diseases. For instance, when you have a cold or a flu and we do a test, we can tell you right then and there that, hey, you have influenza or you have COVID-19. But with menopause, we have to wait a full year until you have had no periods until we can formally diagnose you as being in menopause or being postmenopausal. Now, the one other important factor to note is that it has to be that the fact that you haven't had periods for a year is due to a natural decline in your reproductive hormones and not due to any other disease process or anything else that might be contributing to it. For instance, if you're on certain certain contraceptive pills or birth control pills, you may not get a period at all. But that doesn't mean you're in menopause. That just means it's because of the birth control pills. If you have a thyroid condition and that thyroid imbalance is causing menstrual irregularities and you don't have a period for a year or more, you're not in menopause. That's just coming from the thyroid. So really all avenues have to be explored here. And that's why a thorough discussion is really recommended with your gynecologist. All right, folks, in case you missed it the first time, here's how you can send us those questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
So this next question comes to us through our Instagram page, and it's from Pilar. And Pilar wants to know, greetings, Dr. Kaur. I'm a 50-year-old woman who's currently going through menopause. I obviously know what the symptoms are as they've recently become close friends of mine, but what I'd really like to know is what are some of the adverse effects, like bone loss? Hi, Pilar. Thank you for sending in your question, and it's a great one. Here's what I think, or here's what I know. So with menopause, there are drastic changes in some of the women's reproductive hormones, some, if not all, honestly. And most of these, most notably, is estrogen. Menopause is accompanied largely in part, menopause is due largely in part to a reduction of those estrogen levels, and at some point when a woman's body completely stops producing them altogether. In fact, that's probably when you get the most drastic symptoms and potential health complications or health side effects. Now, having a reduction in estrogen can cause a variety of things. And yes, bone loss is probably one of the most common ones. That's why you'll notice whenever you reach a certain age or after menopause, when you start to go in to see your primary care physician and you have your annual exam, primary care physician may recommend that you take a certain amount of calcium, a certain amount of vitamin D, do certain types of exercises to really help prevent bone loss and loss of bone density that's going to come naturally with that decline in estrogen. Now, estrogen helps your body in building, maintaining, and helping to grow bone density. So you're keeping your bones nice and strong. And of course, as that declines, so do those mechanisms, and you're at an increased risk of fractures. Now, one of the other things that happens with a decline in estrogen is an increased risk of cardiovascular disease. Now, many women don't know this, but estrogen has, among its a variety of good effects on our body, has a little bit of a cardioprotective benefit. So what that means is it helps protect against heart disease. When you lose estrogen, your risk of heart disease does increase a little bit. And again, this is different for every woman, but it does tend to happen. Now, this happens because there is a higher rate of cholesterol being built up in the arteries, most notably the heart arteries, and then that leads to coronary artery disease. And naturally, there's a little bit of increase in your blood pressure as well. Now, how high is the blood pressure going to go? Is it going to go into hypertension or abnormal levels? That really depends on a bunch of factors, right? How healthy you are at baseline. Are you getting enough sleep? Are you exercising enough? Are you eating a healthy diet? That's all going to really go into estimating your risk for that as well. The most annoying adverse effects, perhaps, of menopause is that weight gain that many women experience. And this is usually due, again, to the hormonal changes. And because of those hormonal changes, the body promotes the buildup of fat, particularly in the midsection. So in the abdomen, in the thigh, well, above the thighs, but muffin top, that tends to happen as well. All those areas that we as women absolutely hate. Yep, that's the target area for fat buildup in menopause. So it's not something that I like to tell women, oh, it's going to happen. Don't worry about it. No, yes, anticipate it, but there are ways that you can help prevent it and treat it as well. Another thing that happens is when estrogen levels decline in your body, so do your collagen levels. They have a relationship there. So because of that, you might see changes in your skin. Skin starts to sag, you might be more prone to getting wrinkles. And those are some changes that can happen with the skin as your estrogen starts to go down. Now, it's important to remember that how much, if any of this, you're going to experience really depends on your baseline lifestyle. How much healthy foods are you eating? How many processed foods are you eating? Processed sugars, processed carbs, white sugars, white flour. How much of that are you eating? Are you drinking enough water? Are you exercising regularly or not exercising regularly? Are you drinking a lot of caffeine? Because that can have a detrimental effect on your hormones as well. Are you drinking alcohol on a daily basis? Because that can certainly have a bad effect as well. Do you smoke? And then always taking into account genetics. Genetics is something that we can't change and we can't really do anything about for the most part. But having a healthy lifestyle at baseline is going to be probably your best bet at trying to prevent a lot of these perimenopause and menopause hormone type related symptoms. The healthier you are, probably the less that you're going to experience a lot of this. And we've seen that in studies too. All right, friends, we finally got a question from Facebook, and this comes to us from Randy. And Randy asks, hi, Dr. Kaur. Boy, was my wife Hillary mad at me yesterday. She said she was having hot flashes, and I guess I misunderstood. I thought hot flashes meant that she wanted to get amorous, but that was obviously not the case. So my question for you is, what are hot flashes? Oh, Randy, I can only imagine what your wife said and how she responded after you made your move. Well, I'm glad the misunderstanding was cleared, and I'm glad you reached out to seek a little bit of knowledge on what your wife may be going through. Now, hot flashes are the most common symptom reported and felt in the perimenopausal and menopausal stages. Actually, about 80% of women are going to experience this. But did you know that sadly, only 20 to 30% of women actually reach out to their doctors or reach out for medical help to alleviate these symptoms? Again, this is why it's so important for me to stop and highlight the fact that your physicians are here for you. We're here to support you through this journey and to really help you understand it so you can be more comfortable through it and comfortable with it. So please reach out. Now, clinically, a hot flash is a sensation of sudden warmth just kind of taking over your body. You might even get a red face. Your chest might turn red as well. You might start sweating a lot. You might get really anxious, feel a racing heartbeat. And it's a very high, intense sensation that lasts typically a couple minutes. Now, some women can experience hot flashes once a day or twice a day, and some women can experience them continuously, every half an hour, every 20 minutes. There's really no rhyme or reason to it. And it is just one of the most annoying things that can occur. And basically, this happens again to those changes in hormones, to the lower amounts of estrogen that are roaming around in a woman's body at the time. Now, estrogen has a little bit of a role in regulating our body's thermostat. So when estrogen starts to go down, our thermostat kind of goes wacky. And when it goes wacky, you get temperature changes and dysregulation, and you can experience those hot flashes. And additionally, a woman is actually more likely to experience hot flashes if her lifestyle at baseline isn't healthy. So if she smokes, that's been related to a higher incidence of hot flashes. If the woman is obese, If she drinks excessive caffeine or excessive alcohol, she'll be more prone to getting hot flashes. Or if she eats a lot of processed foods, sugar for sure, processed sugars. And I don't mean sugars in apples and grapes and fruits, but I mean those processed cookies and all that yummy stuff that we really shouldn't be eating too much. Now, Randy, these can be quite intrusive and bothersome symptoms, and I encourage you to sit down, talk to your wife about it, make sure you're both on the same page, and then maybe even go to her doctor's appointment with her if she's comfortable with it to really show her that you're supporting her, because I think that's really going to help her get through this transition and then for you guys to continue living happily together. All right. It's been quite a day of menopause and perimenopause, and there's so much more that goes into these conditions, and there's so much education that needs to be put out for women and for their partners and for men, for everybody to really understand what this is. It's an important transition in life that every woman is going to have. Every woman is going to experience it differently, and every woman is going to get through it differently. Most important is to support the women in your lives, and for the women, it's very important for you to reach out to your primary care physicians and to your gynecologist so we can tell you what to expect, help you through it, and really narrow it down for you. Well, that was a wonderful show on perimenopause, menopause, and all things related. There's so much more to know about this transition and natural journey that all women are going to take. As always, I encourage you to discuss your symptoms with your primary care physician, and in this case, your gynecologist as well, to really get into the nitty-gritty of what you're feeling. Thank you again for sending in your questions. I hope you had a great time. I'll see you next time here on Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.